Hi, I'm Jackie Mitchell with your Senior Advantage team, and I'm here with Dr. Richard Sterling, who is a wonderful eye doctor located in Bluebell.
Thank
Nice
you.
to see you again.
Thanks.
We'd like to talk to you just a little bit about eyes today, Rich. Can you tell me the difference between, say, an optometrist, an ophthalmologist, and an optician? Because I
Sure.
think everybody gets that kind of mixed up.
Absolutely. Yeah, in this world, in my world, it's the three O's, and it's all different states. In the state of Pennsylvania, tomorrow you can open up a place and call yourself an optician. So there's no licensure in the state of Pennsylvania. So generally speaking, an optometrist does eye examinations, fits contact lenses, diagnoses diseases, treats some diseases, and that's our bailiwick. Ophthalmologist does many of the same things, but they'll do surgery. Schooling similar, 4 years undergraduate for optometrists, 4 years graduate school. Some go for residency. Ophthalmologists, 4 years undergrad, 4 years medical school, residency, internships. So essentially in Pennsylvania, it's surgery is the difference between an optometrist and an ophthalmologist. I'm an optometrist.
Okay, so the optician, what do they do exactly?
In the state of Pennsylvania, they sell frames and lenses.
That's what they do.
Yeah,
Okay.
Yeah, a dispensing optician, a bench optician is one who actually takes the lens, which starts out real big, and fits it into a frame.
What's the difference between the private eye doctor and the doc in the box? Is the optician the doc in the box, or is that something else?
No, the doc in the box, basically, optometry would be probably under that category. You get out of school and you can even go into a private practice, which is your own business, or you can go to work for a corporation, like one of the lens crafters, the Pearls, the Sears,
Gotcha.
J.C. Penney's, that kind of stuff. So the doc in a box is common because they're owned by large corporations.
Okay.
I'm a small private practitioner. That's what we're called. Standalone, not in a strip center, private practice.
Okay. Why do people talk about having dry eyes when their eyes are watering? You hear all these ads about dry eyes on television.
Absolutely.
And why are their eyes watering if they have dry eye?
And it's an incredibly common question. I'll be brief. The surface of the eye is covered by a layer of tears, which has 3 layers to it. One is water, one is nutrient, and one is real thick, sort of like 10W40 oil that's supposed to stay on the eye between blinks, let's say for 10 seconds. Instead, it evaporates too quick. A person who has a dry eye has evaporate. It doesn't stay around long enough. You blink, you're feeling a little dry spot. It hurts. It signals the brain something's going on there. The blood vessels get large. That's the redness. The brain says something is in the eye. It's not anything in the eye, it's just dryness. But something's in the eye. It signals another gland that says, flush it out.
Right.
So the reason a person's eyes are watering and red is dryness. So it's a very big business, artificial tears. Very big business. Quite frankly, I usually suggest the way to deal with that is systemically, vitamin A, flaxseed oil, which will increase the thickness of the tear.
Oh, okay. My mother had macular degeneration, my aunt also. And so I think there's quite a mystery about macular degeneration. Can you tell us what it is, and can it be prevented at all?
And it is almost epidemic right now. Macular degeneration. First of all, you might remember from high school, elementary school, rods and cones. The whole entire back of the eye is made up of 2 cells, rods, cones. The cones are the ones that see letters and colors and numbers and distinct quality vision. They're all in the macula. That's the center of my universe. That's where we see stuff with. So when things affect the macula, it's dramatic. It's very difficult to explain, but it's like little islands of vision. So we're not really sure what causes it. Is it age? Is it ultraviolet light? Is it diet? Is it all of the above? Okay, so can you prevent it? Not really. Okay, well, you can prevent it maybe by putting coatings on the lenses of your glasses, ultraviolet coatings. The treatment nowadays, there really is no treatment. There's 2 types of macular degeneration. It's called wet and dry stage. The wet stage you treat. The dry stage you really don't. The wet stage, that's when they start to tell you to take a lot of these things called eye vitamins, okay, lutein and zeaxanthin, because what you're trying to do is prevent it from progressing. Okay, I use this as an analogy. Think about your macula is sitting on this table, okay, and naturally occurring is a sunscreen, okay, and that's called lutein and zeaxanthin. Something happens that it dissipates, and now you have an exposed macula. Okay, so some of these eye vitamins build up the sunscreen.
Okay. Okay, now the one that everybody asks about. Are cataracts peeled off when you have surgery? Tell us about cataracts. They're very common.
Yes, two gigantic myths that I deal with in my field. The one big myth is if I wear my glasses full time, I'll become dependent. That's not true. Second myth is cataracts are a film that grows over the eye. Okay, so here's a model of the eye right here, okay? Imagine this is like you cut my head in half and you're looking from the side, okay? So you see stuff because light goes through this part, then it goes through a hole, which is your pupil. The black part of your eye, by the way, is not a structure. It's where the colored part of the eye isn't. It goes through the hole, and then when it goes through that hole, it goes through this. This is called the crystalline lens, okay? This is responsible, by the way, for a large percent of your prescription. And it's not going to be you're not going to be able to see this, but there's a lot of power in here, okay? So now this starts out at birth as clear. When it becomes like this, that's a cataract, okay? So that's a slow process. It can be induced by steroids, can be induced by other things too, but it's a slow process, and what happens is that person is noticing, God, the leaves on the tree, they're brown, they're not green, okay? They're a little hazy, and when it starts to reduce your vision dramatically to the tune of, and I won't get this too complicated, but 20/40 or worse, then it is suggested and Medicare will pick up the surgery. And what is the surgery? As I said, this hazy lens of the eye is here, so you have to remove it, okay? What they actually do is they remove the back part of it, that's called the capsule, and they get rid of all the contents. Another time I'll explain the exact surgery. But again, you're removing all the contents, you're removing all the power. So back in the old days, you removed it, and then that person ended up with Mr. Magoo glasses, real thick, ugly glasses that slip down on the end of the nose, very difficult. But now you take this hazy lens of the eye and you replace it with, this is called an implant, a lens implant. So it's taking the power that was in here and replacing it with this. This actually is a model of what's called a focusing implant, which sort of gives you reading abilities afterwards. But cataracts are in, not on the eye. It is removed. They go into the eye and remove it, but it is a pretty benign surgery, and it is about 15 minutes per eye to have it done. So wrapping up all those three things that we talked about, dry eye, cataracts, macular degeneration. Can you prevent any of them? Not really, but you can sort of stack the cards in your favor. Vitamin A has been, and C, I'm sorry, has been shown to decrease the progression of haziness in the lens of the eye. Okay, lutein, zeaxanthin, these are naturally occurring supplements. They also have shown to reduce progression of macular degeneration. And as I think I said before, a combination of vitamin A and flaxseed oil helps the dry eye patient.
Right.
Increases the thickness of the tear film so that it doesn't have to be supplemented with artificial tears. You could spend a lot of money on artificial tears.
Do they remove the cataracts at the same time, or are they different? Can they be different on each eye?
Yes.
Or?
Well, generally speaking, because it's minimal now, the way they do the surgery now, it's minimal complications, but there used to be complications with swelling of the back of the eye. So right now, every cataract surgery is done approximately 2 weeks after the first eye. So usually what you do is like you're left-eyed, you're left-handed or right-handed, you're also left-eyed or right-eyed. So if you're, let's say, a right-eye dominant person and you have cataracts in both eyes, they'll do the left eye first, see how it goes, and then about 2 weeks later, do the right eye in that situation. So it's not always done at the same time. Other things like laser vision correction, that's done at the same time, but it's more to control the complications. Very few, but it's done one eye at a time.
Okay. So how come everybody over 40 needs reading glasses, like me?
It's a good thing because it keeps me in business. So again, not to get too carried away here, but the lens of the eye, this thing here, if this was the natural lens of the eye, when you before 40, it does this as you come. It does this. It changes its shape as you come closer than 20 feet. You've all heard of 20/20.
Right.
20/20 is written like a fraction. Top 20 is feet. Bottom 20 is the size of the print. So anything farther than 20 feet, you don't have to focus. This lens doesn't have to do anything. But as you come up closer than 20 feet, that lens is changing. 10 inches is changing a ton, okay? So, like everything else in the body, things dry up as you get older. And this lens of the eye, which is a bag of water at birth, stops. And so you do it. It's trying to focus. You're coming real close, but you can't do it, okay? So you do one of these. The stupid joke in this field is your arms got too short. Your arms don't get too short. You lose your focusing. So what does the focusing do? What does the bifocal do, or the reading glasses do? It replaces the focusing system of the eye with the lens in a pair of glasses. Contact lenses, people can do what's called monovision, one eye for far, one eye for near. People, when they have 45 things, it's called presbyopia. You can go bifocals, you can go reading glasses, you can go what's called progressive addition lenses. So everyone, eventually, if you're nearsighted, probably going to be closer to 50 when you get into bifocals. If you're farsighted, maybe 38 to 40. But I'm going to get you.
Well, I want to thank you for coming in to talk to us. I have one more question.
Okay.
How did you end up where you are in your career? How did you end up doing what you're doing?
Tough one. I've been doing this 33 years. I started in a little town called New Holland, Pennsylvania, Lancaster County. A good friend of mine and I got in practice for 8 years. I went in Center City, Philadelphia for a year. I was in the corporate environment, the big box optometrist for 4 years. I was in a surgical practice for 12 years. I am a colon cancer survivor. Sort of changes your mindset. I ended up purchasing a practice in 2006.
Okay. Well, we're glad you did. We're glad to have you here in Bluebell.